Good afternoon, everybody. We're delighted to be joined by the Chief Constable this afternoon, and I'm pleased to let you know that we have had some encouraging news in this phase of our fight back against COVID-19. The R rate for cases in the community has been pushed down to between 0.7 and 0.9. So together, over this last number of weeks, we've been able to break pathways of transmission and to slow the spread of the deadly virus in our community. And of course, this reflects the effort of people from all walks of life and our businesses, faith groups, charities and public sector organisations who have followed the public health advice to save lives. The Department of Health dashboard demonstrates our case doubling rates has now extended out to 55.5 days, compared with a UK average of 39 days and 17.8 days in the Irish Republic. So a huge thank you to everybody for everything that you're doing and continue to do. And I think it's important to say continue to do, because experience over this last 11 months tells us that this success, important as it is, does not alter the scale of the challenge that is ahead of us. What it does do is that it gives us time for us to push ahead with our strategy to protect you and your loved ones. We're continuing to work closely across all the nations of the UK to roll out our world-class vaccination and testing programmes. And today, the Health Minister, Anne Patricia Donnelly, who heads up our vaccination programme, updated us and told us that by close of play yesterday, 102,701 people have been vaccinated. In 467 of our 483 care homes, residents have received a first dose, and in 72% of our care homes, they've had their second dose of the vaccination. Just over 21,000 of our over 80-year-olds have been vaccinated by GPs, and that's really good news as well. So by the end of the month, we expect all of our care home residents, our health and social care staff, and all of those over 80 to have received their first vaccination. That would be an incredible achievement, and it actually makes us one of the top-performing countries across the globe. So today we have also agreed to pre-departure testing for international arrivals into Northern Ireland. This means that anyone arriving into Northern Ireland who has been outside of the common travel area within the previous 14 days must have evidence of a negative test in the last 72 hours. And of course, the requirement to self-isolate for 14 days remains on all such passengers. Ministers vented their frustration again at the lack of progress with the Irish Government regarding passenger locator forms and the information that we gain from those forms and how that impacts on us monitoring the extent of travellers who come through Dublin up into Northern Ireland. Now, the Attorney-General in the Republic has appeared to confirm that there should be no legal impediment to sharing that information. So ministers have asked us to elevate the matter and raise it again urgently with the Taoiseach. So that's just a few examples of the work we've been doing today to keep everyone safe from the infection. But of course we can't do that on our own. Given the nature of the fast-moving virus, we need everybody to work with us, because by taking positive action over this last number of weeks, we have helped to bring the rate down in Northern Ireland, and we're urging you to keep going. If everybody follows the health advice of staying at home, wearing face coverings and washing our hands well and often, we know that more lives will be saved in the coming weeks and months. Because right now we cannot afford to have a fresh surge of new cases. Our health service is under immense pressure, and this will get worse, unfortunately, in our health service before it gets better, as the number of those who have already contracted COVID and need specialist medical care rises over the next short period. Chief Medical Officer advised us today that the number of new hospital admissions with COVID should peak later this week, beginning of next week. However, the numbers being treated in our ICU departments are unlikely to peak for another week or so. So we're all now partners in protecting people and preventing a greater loss of life. And I'm delighted that one of our partners, our Chief Constable Simon, is with us today to provide an update on the important work of his officers on the ground to inform and encourage the public to keep those public health regulations, and also, where necessary, to take decisive action to put a stop to reckless behaviour in our communities. Before I hand over to Michelle, I just have to say I find it incredible, frankly unbelievable, that there are still people who are holding house parties and other social gatherings at this time, when the rest of us are fighting hard to give everybody a chance to live. I'll hand over to Michelle.